Okay, great. Thank you very much. Good evening, everyone, and thank you for joining another Facebook live chat with Dr. Lawrence Lowe. And I just want to give a congratulations. I know people may not understand sometimes what an acting position or what a permanent, but today in council, unanimously, we confirmed Dr. Lawrence Lowe has been doing an amazing job during such a difficult period as our permanent Chief Medical Officer for Peel Public Health.
Thank you so much, Councillor Medeiros. It's an honor to serve the community, and it's a pleasure to be here tonight to answer some questions.
Thank you very much. And for everyone who's watching, we've had a long day. Regional Council went long, and just kudos to Dr. Lowe, because I know he's been, let's just say, a lot of people look for him. And since my last Facebook live chat with you, I've had many people asking for another one, and here we are. So, and I know especially at a time where we've gone into our second phase. And just before we start, I just want to remind everyone who's listening, and Dr. Lowe, our reopening working group at the City of Brampton, we received over 4,500 responses to our online survey. And we've met with several groups, including seniors, youth, businesses, culture and sports feedback. And you know, one thing we heard loud and clear, Dr. Lowe, is people want us to be cautious about reopening anything. So, you know, and I think that really reflects what you've been telling us about our cautious approach. So I'm going to get right into questions. People don't want to hear me talk. And Dr. Lowe, you know, it looks like we're getting somewhat of our summer back. And so what should the public keep in mind as they start using the many opportunities that are reopening?
Yeah, you know, it's a great question, Councillor Medeiros, and I'm glad to hear that there is such interest in the reopening and commitment from the community that we do want to proceed gradually. As I've been saying all along in my public representations, stage 2 of the province's reopening framework is a move forward into a new normal. It is not a move backwards into the old ways of life. We still have COVID-19 in our community, and one slip up can lead to clusters, which can lead to outbreaks, which can lead to many more transmissions, which would lead us back to the picture that we had in March, which is not where we want to go. So I really applaud everyone, businesses, residents, for wanting to take precautions. The best way that we can protect ourselves going forward is to remember what are called the core 4 behavior. So the core 4 behaviors, it's a campaign that we've launched here at Peel. You've also seen it in other jurisdictions as well, but you've heard me saying it for the last few months. It's a matter of people making sure that they're washing their hands frequently, making sure that you're maintaining that critical 2-meter distance with people outside of your social circle, that you are wearing a non-medical mask where that's difficult or not possible, for example, on transit where it's now mandated, or in interior spaces such as retail or you know, grocery stores, etc. Definitely be wearing a non-medical mask. And then if you feel sick, you should absolutely be getting tested and then staying home, because that's one of the surest things we can do. If you're feeling sick, you got a cough, you got a fever, a runny nose, even if it's the most mild symptom of all, you should probably still get tested just to make sure it's not COVID, and then stay home until you get the all clear. And so in terms of those 4 core behaviors, there are a lot of things that we can do. Sticking to the social circles, the social gathering limits is important. And I'll explain quickly what the difference is. So a social circle refers to a group of 10 people with whom you share close contact with. So this can be, you know, your family plus extended relatives plus maybe some close friends. Those 10 people need to commit that they are distancing from everyone outside of that circle, and you know, right to the extent possible. And so that's how you actually move forward together, and you can actually have closer contact in a social circle. Social gatherings, on the other hand, are still limited to 10. We don't want to see massive crowds because we know COVID likes that. So what you want to do is you want to have social gatherings of not more than 10 people, and people should still be spaced 2 meters apart. And then the last thing that I'll mention as well is, because COVID is spread person to person, it's helpful to keep track of interactions as well. So if you have like an online diary, like an agenda for your day and all these other pieces, you'll be able to remember who you came in contact with, etc., in the event you test positive. And for business owners that are reopening, a reopening plan is critical, both to manage interactions on your site, and then also things like a visitor's log or reservations log can keep track of who's coming in there. So there's lots of things we can do to track our interactions, so that in case someone gets sick, we could follow it. There's lots of guidance on circles and gatherings, And all of that is meant to help people stick to the core 4 behaviors, which will help us unlock our community. So, Councillor, I don't know if that answers your question, but
no, that's excellent. And Dr. Lowe, you talked about testing. It's interesting because we've seen some pop-ups in Brampton, and we know at South Fletcher's we have a drive-through from 8 to 8, just to remind everyone out there. And can you tell us, is that part of a strategy why all these pop-ups in Brampton? I've heard residents ask, why are we focusing on Brampton? I heard the numbers, but is that part of a strategy?
So certainly what we've noted, at least in the region of Peel, is our transmission, while it is still circulating in our community, it's largely located in workplaces and in large household clusters. And I think there's a certain nature of living arrangements in Brampton where certain neighborhoods have very large multi-generational households. And so by virtue of that, if one person in that household gets COVID, then you've got 14 or 15 people who are at risk of getting COVID, particularly if they're not following if you're not following appropriate self-isolation protocols. So one thing that we've tried to do is we've tried to set up these pop-up testing centers to go out to neighborhoods where we have seen higher COVID activity amongst residents, a higher incidence rate amongst residents. And it's important for me to stress that that's not I try to avoid the term hotspot because it's a bit stigmatizing to use that term. But what it is it's really just places where more people, more residents of Peel have tested positive. And so that's really the focus of why we're setting those pop-up testing sites, because it's just easier for people to get tested if they've come into contact with or have a concern that they may have been exposed to COVID-19.
Okay, thank you. So I have a question here from Athena Cochran. In the Brampton Guardian, it says that Kings Point Plaza McDonald's is closed because an employee has COVID-19. I did see it was closed when going to work. Why don't businesses like this have a sign out warning people? Because not everyone reads the Brampton Guardian. So, and I've seen there was an article, I think recently in the media too, why aren't businesses, or why can't we call the businesses out, or why aren't they obligated to self-promote or at least let us know that they've had an employee who has COVID?
Yeah, it's a great question. From a business perspective, the decision to disclose is left up to individual business owners, and so some of them have taken it upon themselves to list and disclose where employees or staff may test positive for COVID. From our perspective in public health, we actually are trying to balance the difference between sensitive personal health information of individuals and businesses against transparency. And so we in public health will absolutely disclose locations, dates, and times if there's an identified risk to the public. But if through the course of our contact tracing investigation, we've identified all the individuals' close contacts and that there is no broader risk to the public, then that becomes a personal health issue. That becomes something that we need to respect, similar to a physician with a diagnosis. If there's no risk to the public, then you need to keep sacrosanct, the diagnosis, especially given all the stigma and concerns that there are around this disease. We treat it very carefully, just like any other disease. We wouldn't be disclosing where people who have HIV or people who have chlamydia would work if they're so I think that that's the balance we strike in public health. But it is up to individual businesses if they choose to go ahead and disclose that they've had an exposure. That's entirely their prerogative. But for us in public health, we do have that broader privacy versus public risk balance that we're always navigating.
Okay, great. So I do have some more comments, and I know the former Caledon Councillor Barb Shaughnessy is wishing all of her best. So hello out there. Arshdeep Sahi says, is it possible if the region can monitor sewage to see if there's a second wave?
Yeah, so first of all, hi, Councillor Shaughnessy, and hope you're doing well. And then in terms of sewage, I actually am not the right person to speak to this, but if you're interested, I do know that our public works people, I think they've actually been looking at a pilot to start using COVID-19 testing of wastewater as a biomarker. And we know that that other countries have started doing this because it is excreted in fecal matter during an active infection. And if you start to see a spike of it in wastewater, it may indicate a looming outbreak or a risk of further propagation in the community. So I know our public works colleagues have been doing it. I remember signing off on it, but unfortunately the details that I have as to how it's being rolled out are not something I have at hand right now.
Yeah, and Dr. Lowe, just on that subject, and I know you mentioned last time you were here about a possible, in the future, a test that could sort of detect if someone's had it before. Because it's interesting, a lot of people now, including myself, we've gone through a bad flu back in December and January, and we think that based on what some of the characteristics of COVID is, that we could have had it. Is that something that's going to come in the near future?
Yeah, so Councillor Medeiros, there's two questions there, which I'm going to quickly tackle. One thing is that increasingly we're getting reports from other jurisdictions in the world, either through post-mortem studies or through for example, wastewater treatment, I believe in Italy, which suggested that coronavirus may have been circulating in these areas much earlier than they were first identified. Question of it being circulated in December and January. Right now, it's plausible. Right now it's all hypothetical. It's stuff that needs to be studied further. But the big thing that I'm actually, the bigger question, the bigger underlying question is, we still know very little about the actual origins of COVID-19. We understand it was the seafood market in China, but then there's now research coming out that shows on the basis of internet search terms and on the basis of hospital satellite data that there may have been a health crisis in Wuhan brewing from as early as August, and that was out of a Harvard study. So the trouble, one of the issues in terms of whether people have had it earlier is that we still have very little information around the origins of this disease beyond what we've been told so far, and I think that's going to be something that comes out further and further. In terms of figuring out whether people have had it, though, because a lot of people have that same question: did I have it earlier on? Was it just written off as the flu? We do know that there was a serology test that was approved for use by Health Canada, and I know that my colleagues at Public Health Ontario have been looking at the accuracy and the reliability of this test. And at this time, they feel that it's not necessarily great as a diagnostic test. So they're running it more from a research perspective, a sero-survey study. Part of the federal government was going to basically survey a lot of blood samples to see if we have a proportion of people who may have some immunity or some antibodies. And I think that's where it's going to be used. But I think having it used for clinical diagnostic purposes is probably still a bit of a ways off until we're absolutely certain about the reliability of the test for diagnostic use.
Okay, we go on to the next question from Jasmine Sahi. Hi, Martin. My question is coronavirus affected by the heat? And do you think it's why cases have gone down now?
Yeah, Jasmine, it's a great question. There's a few things here. The reason why cases are starting to decline in our region there's multiple factors. First of all, if you think about just overall human behavior and what we've been doing, we've been physically distancing, we've limited our interactions, so it limits spread. And that has resulted in things coming down. Certainly the summer is, the heat is one thing that we wonder about. The reality is that many warm weather places, for example, Brazil, Ecuador, India, they have seen significant propagated outbreaks of COVID-19. So there are some questions, and it's still being actively studied, if there's a temperature and humidity sensitivity that's out there. And certainly as with the United States and with many other countries around the world that are still struggling with this disease, we certainly think of those places, and our thoughts and best wishes are with them. But I would also say we're still learning a lot. I mean, there's the reality is that we're all spending a lot more time outdoors, and we do know that evidence suggests that being outdoors is safer than indoor transmission, just because the droplets are maybe more dispersed, especially if there's wind. But that's not a reason, by the way, to ignore physical distancing or the core 4 behaviors. But I think the jury is still out about whether there's a temperature or humidity sensitivity, just given the picture we see in some more tropical areas in the world, and also the fact that there's so many other factors that are contributing to us being in the tail end of the first wave right now.
Thanks. So another question I got here from Nenning Christine, and my apologies because I do muck up names sometimes, is will there be an updated version of the amount of cases in Brampton according to postal code? I know many people have been searching for a more current one.
Yeah, absolutely. So that the data that you see there, it should be, I believe, current as of June 14th. The thing about, or June 10th rather, or June, wait, hold on, let me look up my calendar real quick. June 12th, sorry. So it was basically 2 weeks ago, Friday. The reason why we updated on a 2-week cycle is because we want to be able to see enough of a trend of change in the neighborhood. So updating it daily doesn't really make sense because it doesn't change that quickly from day to day. And we also need to be able to have enough data to sort of identify a trend. So the way it works is we take the data from each 2-week block, and then it takes about a week to actually put it together. So the next update will be through June 26th, and that update will come next Friday. But in general, the reality is that the neighborhoods, they don't change too rapidly. So the cycle that we have here should be the most up-to-date information, or fairly reflective of what we're seeing in the community.
Thanks, Doctor. Marco Gomez wants to know, Brampton, over the last 7 days, we've seen a decline. Can you talk to us specifically about Brampton?
Yeah, so all of our municipalities in the region of Peel have been seeing declines. Caledon has actually had a plateau of low case counts for some time, and Mississauga has seen a consistent decline. Brampton has been declining, but it's been a slower decline, and it's also a matter of seeing like little spikes and peaks day to day. So, for example, there was a little bit of a spike today. A lot of that is driven by testing, because as you know, we've focused a lot of our testing efforts, in Gore Meadows, out in Bolton on the border with Brampton, and then certainly we're going back to Gore Meadows again today. So we're just, by virtue of that, picking up more cases in Brampton. But a lot of it is also just the same stuff that has driven the ongoing outbreak in Brampton, which is just the nature of our employment profile. So some of the big workplaces that haven't taken measures and are seeing spread in those settings, which we're trying to control, and then also those large households. So I think it really speaks to the importance for everyone to make sure that they're taking the core 4 behaviors seriously, and especially if you're a business owner and you're opening up, you want to take this seriously and make sure you have precautions in place so that you're not seeing COVID-19 spread amongst your staff or customers. I think it's going to be very important to take those precautions.
So as part of the numbers in Brampton, Doctor, Marco Gomez goes on and he brings up the point regarding retirement homes and long-term care facilities. So when we look at the total numbers, is that counted separately, or is that all part of all the numbers that we report on in Brampton?
It's a really great question, and so all the long-term care homes and retirement home cases are counted in the cumulative total for the city. So basically, people who are living in those nursing homes will be there. What you will notice, and what you might find interesting, is that if you look at death counts and you're comparing deaths due to COVID-19 in Brampton versus Mississauga, the reason why Mississauga's death rates are so much higher is that there were a number of long-term care homes that were hit very heavily in Mississauga, and of course, we see much more severe outcomes, unfortunately, in individuals who are over the age of 70. And so that in part explains the differential in terms of the death rates. And it's a good time for me to actually drive home and emphasize something. One thing that we have been seeing in Brampton consistently is we have been seeing a lot of cases in people between the ages of 20 to 29, and also between the ages of 30 to 50. 30 to 50 folks are the ones that are in the workplace outbreaks that are working there. Same with the 20 to 29s. And then there's also some concern that there are people who are between 20 and 29 who are just ignoring the recommendations, ignoring physical distancing and masking. And certainly we've heard about all these large backyard parties and all these other things that people have been doing. Honestly, that is really just playing with fire at this point in time. We do know that going to stage 2 doesn't mean that we're out of the woods by any stretch of the imagination. And coronavirus likes a crowd; it likes a party. So if someone with coronavirus maybe they're not even symptomatic yet, they show up at your barbecue, then bam, suddenly 60 people are exposed, 50 people are exposed, and we can trace all that. But it's better to just not have that risk in the first instance. So that explains Brampton's numbers, both from the cases, the distribution of cases by age, and also the differential in deaths between Brampton and Mississauga.
So Dr. Lowe, as on Wednesday, we announced Brampton going into its second phase as Peel, other municipalities in Peel region. Do you have any advice for those, those who want to take their little ones to splash pads, and some who will be using sports fields? What advice can you give to anyone using these type of amenities?
Yeah, absolutely, Councillor Medeiros. It's a great question. Again, really the core 4 behaviors are what you should be trying to do as much as you can while you're out and about. So if you're going to the splash pad with your little ones, to the extent that you can, and I know it's really hard, I've got kids myself, and physical distancing is sometimes a challenge, but to the extent that you can, try to make sure you stick to your family unit, you stick to your social circle. You can certainly socialize, but making sure that you're keeping that 2-meter distance. And then certainly with sports fields, etc., making very clear, that you're also staying apart. So I know if you play soccer, maybe it's more of a passing game than a tackling game, but basically you want to try to make sure you're keeping that critical distance apart while you're out and about to reduce the risk of transmission as much as you can.
Thank you. I have a question from Devinder Baines. Has the region put out guidelines for religious places that open to operate safely? And I know there was a lot of discussion. We had it internally with our bylaw in terms of 30% of the building, and what number do you calculate? Because I've had some religious places of worship reach out to me to ask as well.
Yeah, absolutely, Councillor Medeiros, and thank you, Devinder, for the question. We reached out through a number of interfaith councils and the mayor's offices, and also through our own lists at Peel Public Health to provide the provincial toolkit around reopening. And so certainly, if you haven't had a copy or haven't received a copy of it, you can call 905-799-770 into our call center, or send an email via the Region Appeals email form, and we can certainly get you a copy of that guidance. It is available. There is provincial guidance, and yeah, it's everything you'd expect in terms of how to limit occupancy, keep a visitor log, put precautions in place, encouraging masking while indoors, limiting singing, that sort of stuff. But that is available and it's been circulated. And so certainly if you're missed, do reach out to us at, again, 905-799-7700.
Great, thank you. So Dr. Lowe, when we talked about the second stage, and I know there's some anticipation and caution, and people are already starting to think about the third stage. And I know today at council, you really portrayed what it means to go to a stage 3. So the idea is that we entered stage 2, so we're close to stage 3, and that's not really the case. If you can, lay it, what does it mean to go to stage 3 and where we are right now?
Yeah, so the province's framework for reopening is pretty clear. Essentially, stage 3 is everything about everything that we used to have open, except for large gatherings. So basically, concerts, large sporting events, celebrations celebrations in downtown Brampton or at Chinguacousy Park, like those are all out for the foreseeable future. And also not just in public spaces, but also in private spaces. So that means things like weddings, banquets, etc. Because again, coronavirus likes a crowd. Those are potential events that result in super spreading. So those would always be obviously be out of, it's difficult to physically distance in those sort of settings. So those would be limited for the foreseeable future. But otherwise, stage 3 is pretty much everything else reopens, which, as you can imagine, is a bit of a tall order. And certainly we want to be seeing, as I've said, we've seen cases come down, but we are still seeing, a moving day average of like 30 to 40 cases a day, which translates into about 200 cases a week. But that can get away from us very quickly because we know this virus spreads exponentially. So I think there's two things that I would say then about stage 3. First of all, we need to all be very vigilant and careful in practicing the core 4 behaviors. Business owners, as you reopen, make sure you're taking those precautions to keep people safe, because those are the keys to unlocking our community, unlocking our economy. And then I think the other thing just to remember is that I think we are a lot closer. Phase 1 and phase 2 were always a lot closer to each other than phase 3 would be. Phase 3 is definitely a little bit further, and I would estimate, just with the way trends are going, it would probably take at least the rest of summer before we actually get back to a place where I'd be comfortable about moving to a stage 3. And that's an at least, right? Because again, we may have another regional reopening approach to stage 3, and I presume the metric that the province will probably be using would be no or single-digit cases for a certain period of time, which we're not quite at yet.
Wow. I have a question here from Kasim Mohammed, and my apologies again for maybe not pronouncing it correctly. Any update on vaccines? And I know that seems to be the magic solution everyone's waiting for, a lot of anticipation. And I myself, I can tell you before I go to bed, I'll do a little scan on all the newspapers across the world to see if there's any tidbits about a vaccine coming. Any comment?
Yeah, absolutely. Thank you, Councillor Medeiros, and thank you, Kasim, for the question. Nobody wants a vaccine more than I do. I think to some extent it would be really helpful for me to get a good part of my life back. But although to some extent, I will say this as well: public health will be on the front lines. If there is a vaccine, we'll likely be in charge of presumably mass immunization programs. supporting our community and rolling it out. So that is also something and a contingency we're planning for. I would say there are three main scenarios that we're planning for in public health. The first scenario is that we have a vaccine in short order, presumably like by the end of the year, by the early phase of the year. Most vaccines take 12 to 18 months to actually go through all of the different clinical trials and phases. But from everything that I've read and from what I understand from colleagues that are working in vaccines, this is an unprecedented time, and they're trying to smoosh all these phases together as quickly as possible so that we can actually try to get something approved. And so the thing is, when it gets approved, they're looking for two main things. It needs to be safe and it needs to be effective. That is what you're looking for with a vaccine. And so I've seen estimates in terms of the accelerated development of there may be something ready by late fall or the end of the year, to more realistically what I think, which would probably be in the spring of next year, which would be, that'd be about 12 months or so from when people started looking for this, which would be in keeping with the usual timeline on the fast side. The second scenario that we're planning for is that it takes much longer to get a vaccine. So 3 to 5 years. So what do you do then if you're looking at that length of time? So now you need to, there's basically two main things that we're planning for or hoping for in public health. First of all, medical therapeutics advancing to the point that we have cures that limit mortality, and also cures that limit severity, right? Because I think the thing that people forget is, we are concerned certainly about deaths related to COVID-19, and certainly we feel for everyone who's been impacted by that. But we also know that there are people who survive COVID-19 and then have some very serious complications that they live with right now that potentially are permanent. For example, lung damage and all this other stuff that we're reading about. So if we're able to advance in our medical knowledge to the point where we can treat this and limit the severe outcomes and the deaths, then we're getting to another point where we might start looking at limiting restrictions, particularly if the vaccine is far off. Then the last scenario that nobody really wants to think about, and I honestly think, hopefully is where we're going, is what happens if there's no vaccine at all, right? And that's where you really need to really push the advancements in the healthcare field, making sure that we're keeping people well. It was a non-zero possibility when this started, because the reality is that we've never had a vaccine for a coronavirus before. And there are 4 other common coronaviruses that cause the common cold. And essentially over time, it's evolved. Over time, the virus evolves to become less deadly because the host that it kills off, that's evolutionarily bad for the virus. The virus is that's an evolutionary, that's an evolutionary cul-de-sac for the virus too. So ultimately, the virus evolves over time to become less deadly because then it can actually infect hosts while also keeping itself in existence. But then also the other thing is that we also develop an immunity, right? So the reason why this virus is so scary right now is that it's new and none of us have any immunity to it. And none of us knows how our body is going to react if we're infected with it. Most people have a mild illness, but that's not always the case, right? And so, but the idea is that with repeated infections, with people who get, if that's a thing, and they're still looking at that, but if people get repeated infections, then now you're in a situation where they get infected a second time, their immune system is possibly able to handle things better than they would otherwise. So it's a great question, but the big scenarios are we have a vaccine in breakneck speed order, we have a vaccine that takes a little bit longer, and also the possibility that we may never have a vaccine at all. And we're planning for all of those scenarios.
Wow, just that third scenario gave me a little goosebumps.
Sorry.
Yeah, but that's kind of the advice that we're looking towards, and we appreciate your candidness. Suyog Prandan, again, my apologies for pronunciation, reference to Peel Region, when schools, colleges, universities be reopened, what safety precautions will be applied to ensure minimal to no spread?
So, Councillor Medeiros, it's a great question. And honestly, we actually have the fortune in Canada that we actually went and got and started our outbreak a lot later than other parts of the world, right? And so we are able to look to those countries and jurisdictions for their learnings. And we know that, for example, in China and in Germany, even in Quebec, right? In some places, the way it looks with in-person learning is a lot more hand sanitizer, a lot more physical distance, smaller class sizes, rotating days. So for example, like 4-day school weeks and you're basically 2 on, 2 off, whatever the case might be. So I know the Ministry of Education has given directions to school boards to plan for a number of different scenarios, and they'll be planning for regular in-person, a mix of in-person and online, and then online. And I know that our counterparts at the Ministry of Health are helping and providing input into that. But I think you don't have to look very far to just look at other jurisdictions to see how in-person learning has changed in places that have gone before us into the new normal.
Great, thank you. Another question now from Jeff Chalmers, a famous radio voice out of Brampton, and someone who I have the pleasure to call a friend. So great to hear from you, Jeff. And he asks, while stage 3 might be a tall order, how can phase 2 be justified given Brampton's numbers?
Yeah, it's a great question, Jeff. The reality is that Brampton, even though the numbers are still where they are, they have been on a decline. At the beginning of June, we were seeing significant numbers of cases in Brampton, and I think many of you will remember many of you may have seen me in my weekly press conferences with Mayor Brown. I apologize for coming across as a bit like a stern school teacher, but I was saying, yeah, you know what, we gotta work on this if we want to move to stage 2. I honestly think the community has stepped up. Our trends have been going in the right direction, and I'm really hoping that it'll stay that way with the reopening as well. So, yeah, I mean, I think the other thing that I would mention as well is when it comes to reopening, we always knew the closures were going to be temporary. It wasn't always going to be a permanent closure. And we also know that the longer we leave things open, leave things closed, that also has social and economic impacts as well. I mean, certainly people losing jobs, people not being able to access services, those present challenges for people's health as well. So insofar as I'm a medical officer of health and I'm trying to weigh all the different potential impacts of health in the community, I supported a reopening of Brampton and the region of Peel with the belief and hope and the trust in our residents that we know the core 4 behaviors, we know what we need to do to fully put COVID-19's first wave behind us. And so I guess I'm trusting you folks.
Yeah. And just as, before we go to the next question, but you talked about Mayor Brown, and one thing that's important is the collaboration and sort of the coordination this requires. It requires that everyone's all in. So when, we hear it from the medical officer, and I can tell you, Mayor Brown and my colleagues at City of Brampton, also at Regional Council, consistently, I think everyone's used that opportunity to reconvey what you've told us and reconvey what the message is. So there hasn't been mixed messaging. There hasn't been, it's all been about the science and what you have advised. And I just want to kudos to all my colleagues, because I know they've been consistent in reminding residents to, promote social distancing, hygiene, what you talk about all the time. So no, it's great that you mentioned him. A question here from Athena Cochran, which how many stages are there? So when we talk about stage 1, 2, 3, how many stages are there in the provincial framework?
Yeah, so Athena, there's only 3 stages. It's as easy as 1, 2, 3. And so I think we had the dark pre-stage 1 phase, which was essentially called that was the peak of the pandemic. And then stage 1 was the opening of outdoor amenities, as you know, marinas, golf courses, parks, etc. And you'll remember, many of you on the call may remember that Peel took a different approach. We took a more gradual opening of parks, etc., compared to other places in the Greater Toronto Area, and a lot of that was related to what we were seeing, the picture we saw at the time in May. And then stage 2, as you know, is a little bit more in terms of outdoor dining at restaurants, personal service settings, and then certain other municipal facilities, which include swimming pools and splash pads and recreation centers and all those other pieces, which I know that our colleagues at the city are also taking a careful and considered approach for, and for which I really welcomed a regional approach in reopening, because yeah, I think in early June we weren't ready for sure, but certainly by this time, after having seen a decline for the last 2 to 3 weeks, I was willing to support it. And so yeah, after stage 3 and then beyond stage 3, it's hopefully a return to some semblance of normal, but we're still a ways away yet. So yeah, just 1, 2, and 3.
A question from Charles Baker. I read somewhere that the virus has become less potent and less risky. That virus mutated to weaker. Is this true?
Yeah, so it's a great question. Viruses are always changing and evolving rapidly, and we have to remember that it's kind of like dog years. So you know how a year for a dog is like 17 years for a human or something like that. The same thing with viruses. Days for viruses are like years for humans, and so the virus has been mutating and has been drifting pretty much ever since it came out of China, and especially just given where it's gone in the world. Overall, though, it is still the same virus in the sense that none of us have immunity to it. So insofar as the virus may have mutated, the reality is that we still don't have any innate immunity to the virus. So while there's a good chance in some settings that, yeah, in some settings, and I'm not saying this is the case in Peel because we don't have any evidence this way just yet. We're still looking into it. Researchers are still looking into it for us. But even if a virus drifts a bit, and I refer to it as antigenic drift because ultimately viruses are replicating their DNA and their RNA or their DNA, and every so often they make a mistake, and that's how it tends to evolve. But even if that's happening, the reality is that we still don't have immunity to it, so none of us know how our immune system will react, no matter how less potent or how the virus has changed. Unfortunately, it's still ultimate. And I'll mention as well, when we talk about the virus mutating, this is really important, an important concept to get across. Ultimately, it's still the same virus. It's just different additions. Maybe it's a little bit more aggressive. Maybe it's a little bit more easily transmitted, whatever the case might be. It would be the difference between saying like you have a 4-door versus a 2-door Honda Accord, as opposed to like a Honda versus like a Mercedes kind of thing. Like that's so it's not like a vastly different virus. It's just, now it's got a spoiler or something. So yeah.
Yeah, no, that's I tell you, really fascinating stuff. Katrina Gialamis, again, and I know she was with us last time. She has a real good question, so I've wondered the same for myself. With the flu season on the not so far future, are you recommending everyone get the flu shot? And can you catch a COVID and the flu at the same time?
So the short answer is yes to the second one, and that is certainly something that we are very concerned about, is if you have COVID and flu circulating in our community. We know that flu sickens and kills, thousands of Canadians every year. And similar to that, if we have COVID circulating at the same time as the flu in the fall, and there are lots of hypotheses. I think the earlier question about is it easier in the summer? We don't know if there's a seasonality, but there may very well be a seasonality, which would mean in the fall and winter, if we saw like a second wave of COVID, we need to be prepared and we need to be ready. And so that answers your first question, which is in any regular flu season, we already recommend that anyone get a flu shot. We have this universal influenza immunization program that's funded in the province of Ontario. I get my flu shot every year. In a season where you have the possibility of flu and COVID circulating at the same time, one of which we have no vaccine for, you definitely want to get your vaccine for the other one.
That's a real good point, Doctor. Thank you. Alvin Liao, I'm not sure the proper pronunciation, but Dr. Lowe, we know masks and face coverings work to help slow the spread and protect people. What is stopping our city from making masks mandatory in public spaces? And I know today the Mayor Mississauga, Mayor Crombie mentioned that I believe Frank Scarpetti out in Markham, he I guess requires that everyone wear masks. Is that something that we as a city have, I guess, jurisdiction?
Yeah, no, so Alvin, at this point in time, it is still strongly recommended that people wear non-medical masks where distancing is difficult. And so that includes both a mandatory mask order on Brampton Transit, which I've supported, but also ensuring that people are wearing masks when you're out and about, grocery stores, getting essentials, to and from your seat on the patio, when you're getting your haircut. Absolutely, it is still strongly recommended. In terms of making it mandatory, one of the challenges with making it mandatory is that you would have to enforce it. And really, if you're issuing a mandatory order without enforcement, that's pretty much a recommendation, right? I mean, so to the extent that we are able to strongly recommend, and certainly I've seen business owners also take it up and make it part of their entry and service policy. I would encourage business owners to consider it strongly, especially for their staff. I'd encourage everyone to consider wearing a mask when they're in an indoor space. That is a strong recommendation. I think broadly in terms of jurisdiction and mandate, Councillor Medeiros, you probably know more about this than I do, but I understand, of course, there's orders that I have that I may be able to issue, but I also know that there are municipal bylaws that may be passed, maybe tied to an emergency order. Ideally, of course, what I have supported and advocated for is that if the context demands it, I would certainly support a mandatory mask piece along with the enforcement action, but ideally that it would be taken at the provincial level for consistency. I mean, it doesn't make sense for Peel to have it, but not Toronto or whatever other jurisdictions.
That's an excellent point. That's an excellent point. I'm almost afraid to read the next question because it almost aligns a little bit with what we're talking about. But you know, God forbid. And Lisa Francisco asked, "What happens if cases spike in Brampton?"
Yeah, so it's a great question. I mean, let me be very clear. As we move into stage 2, we are going to see flares and spikes. That's just by virtue of the fact that we still have COVID in our community. The difference between now and in March is that in March, we had started seeing cases, we had started seeing the establishment of community spread, but we did not have chains of transmission followed. We were essentially starting from scratch. And what you're doing with contact tracing is it's like detective work. You're basically trying to figure out, how did this person get sick, and who else do we need to protect? Who else do we need to isolate to make sure that they're not being sick? And so that's essentially the contact tracing work that's happened while you were all staying home and shrinking your bubbles and reducing your interactions. That made our jobs contact tracing a lot easier because we were able to quickly say, oh, who have you exposed? Oh, just the 3 people in your house. We're good, right? And so now we're getting to a phase where we're reopening, where we have built out these chains of transmission, and we are able to actually start identifying or even possibly predicting where we think this disease is going to go next. But I want to be very clear that as stage 2 happens, we need to be vigilant and do our behaviors and precautions. And even despite our best efforts, we may see flare-ups. We've seen this in every other country that's gone before us. It's a nightclub in South Korea, it's a gym in Germany, whatever the case might be. The important thing is that everyone does the 4 core behaviors, and where it fails, at least we have the testing and tracing ability to figure out how it's all happening. And then our closures can be more localized. Instead of closing down the whole community, it's, you know, we'll close down this office building, we'll close down this neighborhood block, we'll close down this gym, or whatever the case might be. Gyms are still closed in stage 3. But anyway, so all that to say, that's kind of how we're going to be approaching it. And I really hope the only thing I will say as well, if I may, Councillor, we would have to consider a broader community closure if we got back to a picture we were seeing in March, where we have a whole bunch of cases that we don't know, that aren't linked to existing outbreaks that we know of. We have no idea where they came from. And then we're just starting from scratch again. That would be the worst case scenario. But I think we all know what we need to do to put this first wave behind us. And I'm hoping that won't come to pass.
No, and that's great to remind us what could happen if we don't remain vigilant and continue to do what we're doing. Ivan Macri, also shout out to Ivan, who's a big advocate for Brampton in terms of safety in the community, and someone also I consider a friend. He says here, in something interesting, someone has tested positive. What does that mean, someone tested positive?
Yeah, Ivan, it's a great question. The positive test result is only one piece of information that I would need, right? A lot of what we're also trying to figure out, especially when we're doing case management and contact tracing, is we need to figure out what symptoms the person had, and we need to figure out a little bit about their whereabouts in general. The whereabouts are helpful for 2 reasons. Whenever we get a positive result, we try to figure out where the person might have got it from, what were the symptoms they might have had, and then the contact tracing part is figure out who they might have exposed and put at risk of passing this on. And so all 3 of those things are crucial pieces of information. So if someone has a positive result and is asymptomatic, for example, we may ask them to get tested again just to see if it was a false positive. And then if it comes back positive again, then they have to isolate even if they have no symptoms. Or if it comes back negative, then they're good to go. Those are the kind of decisions that happen there. But the big thing that I will say is that every positive result that comes in and that is done by our provincial partners, because testing is a provincial responsibility. So our hospital partners run the assessment centers. When they get positive tests, they tell us about it. And then we launch into this exposure assessment and case and contact management.
Great. Second part of his question is, what's the difference between a virus and bacteria?
Yeah, no, they're different organisms. So bacteria are basically they're cells, but they're actually living organisms that basically spread that cause certain diseases. And they can spread in any way. Usually they can spread through respiratory, or there's a lot of different ways that bacteria can spread. Viruses are essentially just pieces of genetic material. There's actually been long debates about whether viruses should actually be considered living organisms or not, because they require a host to reproduce or to evolve, right? So if it wasn't for human beings, coronavirus would not be able to exist on its own. Whereas bacteria, they will exist on their own, sometimes even independent of a host, for example. So all that to say, they are different. And the big thing that I'll say as well is that we actually have things that we can treat bacteria with. So we've got antibiotics, and certainly one of the big concerns with the coronavirus pandemic is that all of the hand sanitizer that's being used right now is just going to worsen the resistance to antibiotics that many bacteria have started developing. Whereas viruses, in general, we don't have very good treatment for lots of viruses. We actually are pretty terrible at treating viruses. We have great vaccines, right? But if you think about everything that's caused by a virus, like everything from the common cold to HIV, we don't have very good cures for them, and that's part of the issue. So that's why the focus is really on trying to find a vaccine, because we've had great success with vaccines against viruses like hepatitis B, for example, human papillomavirus, which causes cervical cancer. But in general, treatment has always been a challenge.
Thank you, Doctor. Jennifer Krasnichuk asked, Brampton's case numbers seem to have increased over the last few weeks. Is that due to more tests being conducted? Is there any way Peel Region can release number of tests conducted along with positive test cases?
Yeah,
I think that correlation. Yeah.
Yeah, so if you're interested in looking at the Region of Peel's testing results, including our test positivity, you can visit peelregion.ca/coronavirus. And if you click on status of COVID-19 in Peel, it'll take you to our dashboard. And at the very top of the dashboard, you can click a link and it'll bring you to our weekly epidemiologic summary. And so our weekly epi summary usually on the second to last page includes a graph which shows our test positivity over time, as well as the tests that were done per week in the region of Peel. So that information is all available on our website. And then I think the first part of your question, which now I'm forgetting.
Oh, it was just regarding Brampton's cases numbers seem to have increased over the last few weeks. Is that due to more tests?
So actually, in fact, Brampton's case numbers have come down slightly in the last few weeks on a 7-day moving average. Now, in the last few days, there have been a few spikes in the numbers, but that's normal. Typically, when you're in the tail end of the pandemic, you're going to see certain spikes up and down. And also, a lot of those spikes have been driven by increased testing. So we are finding more people just by virtue of the pop-ups that we're doing, and also the significant amounts of tests that are being done through the Osler assessment center at South Fletcher's. So, I mean, that's all part and parcel that's expected, but the big thing is to make sure, at least from our perspective, looking at cases for which we don't have an epidemiologic link, to the more sporadic cases that we don't know where they're coming from, and that number is thankfully trending downwards. So we know where the cases are, we know how they're all connected, and that bodes well for us, even if the decline is maybe not going as quickly as you or I would hope for sure.
Yeah. The next question is interesting. It hits home as well from Lisa Kress. Hi, Martin, Dr. Lowe. What is your recommendation for kids who have a couple friends over? And I just had a 15-year-old once go for a bike ride with his friends, and I struggle to answer that as well. What's your recommendations, Doctor?
So again, the big thing I'll say is that the social gatherings and the social circle recommendations are recommendations, right? And the reality is that we're all going to need to take calculated risks. And so ultimately, the big thing and where we will ultimately get to with reopening is you want to know who the people you're seeing have been. You want to know who the people you're seeing have been seeing, right? That's the big thing. Yeah. And so certainly if they've also been in quarantine, they haven't really been seeing anyone else, and you feel that there's a certain limited risk of transmission there, then by all means go ahead. And then also keep track of your interactions. Like I said, keep track of them, because if someone gets sick, then at least you can be like, oh yeah, I had that play date with so-and-so, and we tried to get the kids to distance. They didn't really distance, but I mean, like, so at least you're able to follow up if we need to. But yeah, so the reality is, to the extent that you can, try to stick to the core 4 behaviors and the distancing. and the gathering and circles recommendation. But otherwise, I think it's up to all of us to really just make sure. And like I said, the other option is if someone's like, yeah, I'll have the kids over for a play date, and you find out they've been hanging out at illegal barbecues for the last 3 weeks, you might have a different risk profile for a play date with that person than if they've also taken the same precautions.
Good, thank you, Doctor. Anarit Sahi is asking, is there any risk to the surrounding community from the pop-up testing centers?
No, I mean, I think, so in terms of the pop-up testing centers, I know that all precautions are being followed, both in terms of staff wearing personal protective equipment, and also, I guess in lines, they're enforcing physical distancing and also masking on site, I believe. So, I mean, I think there isn't really a risk of getting it at a pop-up testing center, and certainly wouldn't be any different from the risk of getting it at a regular assessment center. And the reality is that with community spread, that is still occurring, we have to remember that the risk still exists pretty much anywhere in town. And so it really is important to stick to those core 4 behaviors, especially as we reopen and as we expect things to possibly get a bit hot for a while before it cools off again.
So just following up on Melissa's question, she wants to know specifically, I have a friend over, can my kids have friends over to swim in a backyard chlorinated pool? What are your thoughts around that? Because I know I've heard a lot of kids having small little gatherings in their pool and so on, and people wanting to even know in public pools as well, as some of them are reopening. What's the chance of it spreading through water?
So in terms of this disease, we know that it is not a waterborne disease. So it does not spread in water. The way it spreads is through respiratory droplets. So basically, you being within 2 meters of someone who is coughing, or so far it's been actually interesting, like a lot of studies are showing just someone who's talking or breathing or singing, and just being within that 2 meter radius of them is enough for respiratory droplets to be transmitted. But the big thing that I would say here is pools are fine in terms of the water piece, unless you happen to be within 2 meters of someone who's coughing in a pool, in which case not so fine. So it's not waterborne, it's respiratory droplet transmission.
Great, thank you. Jesse LaVictoire is asking, are I guess the COVID spread workplace clusters or community spread?
So the workplace clusters are considered community spread, and they're included in our numbers around community transmission, because ultimately workplaces are in the community. The people that are in there come from our community, and they go back out to their community after they're done. So we classify those as community. The other classifications we have are institutional transmission and also travel transmission. And then within community, we also will break them down generally for external in the community, and then there's also close contact. So basically community and close contact. But in general, workplaces are considered community spread because ultimately the people that are in there are part of our community.
Dr. Lowe, I've seen a question that came in, and I know there's been a lot of anticipation regarding the patios, outdoor dine-in services. What are your thoughts around it? And I know there's a lot of bars that I've seen in my area. They're trying to get some outside public space. What are some considerations for someone who wants to go to an outdoor patio? You mentioned before that whenever you get up, take your mask. Anything you'd like to stress with us for those who are looking to, get out on the patio and have dinner?
Yeah, absolutely. So first step again is who you're going to go for dinner with. So ideally, it's someone who's in your social circle, presumably because you're going to be spending time together in close contact across from each other. And even if it's not someone in your social circle, if you're going to, disregard the recommendation, at the very least, keep track who you've been in touch with, because certainly that'll be useful in the event that there is an exposure, and try to understand where they've been. So first and foremost is choose your friends carefully. Then the second thing is once you actually get to the restaurant, there's a few steps you can follow. I would encourage you to wear a mask properly, to constantly wear that mask until you are sat at the table. And then once you're at the table, practice proper taking the mask off. And then basically engaging with whoever you're engaging with. Certainly don't linger with servers. I know servers don't want to linger nowadays either, because we know transient contact isn't going to spread the virus. So if they're just there coming out, dropping your food off and taking off, that's going to be all well and good. But I think mask whenever you're not seated at your table with the person that you're enjoying your meal with, and certainly make sure that you're washing your hands frequently. Hand sanitizer or going to the bathroom, masking, going to the bathroom and doing what you do, but wash your hands. And then finally, last thing is that if you feel sick, don't go to patio. Like that's really the big thing. If you're sick, get tested and stay home.
Okay, that's a great one. And probably one of our last questions of the night from Marco Gomez. He talks about that he's worried about bringing his kids back to daycare. What are your thoughts around daycare reopening and maybe some of the strict guidelines they will be under?
Yeah, so Marco, there's actually been a lot of guidance that's been given to daycare operators on how to operate safely. That's the same guidance that we gave to the emergency childcare centers that were operating during the closures. I can say that clearly the guidelines were followed in Peel. We never had an outbreak at one of our emergency childcare centers. We may have had a few cases that tested positive here and there, but they were quickly identified and isolated. So I think you should, provided your childcare facility is following the guidance that Peel Public Health and the ministry have sent to them, you should have confidence in sending your kids there, and then complying, of course, with all their procedures, because I know they're doing things like screening the kids when they arrive, and making sure that parents are also screened and not entering the building and all this other stuff. So I think do your part to stick to the guidelines, and if they're sticking to the guidelines, then hopefully we'll be able to keep our kids safe.
That's excellent. Dr. Lowe, I want to thank you very much once again for being with us tonight. I guess during the summer, for those who would like to get more information, ask more questions, is there a general inquiry email or 311? What's the best way for people who are looking for guidelines? If you can talk about the website and anything else and what people are looking for information.
Absolutely, Councillor Medeiros, I'm happy to share. So certainly I would encourage you to keep, I would encourage Bramptonians to keep tuned to our weekly COVID-19 updates with Mayor Brown and the City of Brampton. There's a lot of good information there. You'll get a quick lay of the land from our updates. In terms of resources, there's our website at peelregion.ca/coronavirus. For businesses that are reopening, I encourage you to Google COVID-19 workplaces. That'll get you to the Ministry of Labor's website, which has sector-specific guidance on how you can open up. I would also encourage, if you have any questions, to call 905-799-7700. Our call center is open 8:30 a.m. till 7 p.m. 7 days a week. So certainly you can also get your questions asked there. And then overall, you can also find us on Twitter at Region Appeal. So I think those are a good place for people to get your information, but certainly appreciate the time that people were able to say all the great questions, and want to wish everyone a happy Canada Day.
Thank you very much, Dr. Lowe. Again, happy Canada Day. And as a reminder to everyone, we have testing at South Fletcher's in Brampton and any other location.
Yeah, actually, thank you for the reminder, Councillor Medeiros. So as of tomorrow, we'll actually also be having a pop-up testing site at Gore Meadows, and I believe they'll be there from 10 to 8. So certainly, if you have concerns that you may have been exposed to someone with COVID and you're asymptomatic, you can get tested at Gore Meadows. If you are symptomatic, we do ask that you go to the South Fletcher's Assessment Center, because that's where we send the symptomatic people.
Excellent, Dr. Lowe. As usual, thank you very much. Oh, and again, Jim Archdeacon next Tuesday, as a reminder.
Yes. Thank you, Jason.
Dr. Lowe, thank you again. Once a great job. And everyone, as you say, do your part, stay apart. And I wish everyone a good evening and stay safe.
Thanks. Good night.